Hi, everyone. Thank you so much for joining my channel for today's live. If you were watching my previous live and you got cut off, I really do apologize. For some reason, the connection became unstable, more than likely because we're having a small storm here. Anyway, so this is going to be a little bit of repeat if you watch the other one, and hopefully not a lot of new information if you're just joining me for this live. So today we're going to talk all about the diagnostics of palpation. My name is Maya Suzuki. Thank you so much for joining. So just to recover the information that we had in the previous live, and if you're watching and already saw this, I'm so sorry, but I'm going to repeat myself just a little bit. Today's conversation is going to be all about how we can take our palpation and really help our treatments to get to another level. So in my previous live last Wednesday, I talked about heart palpation and how I really did think that it was superior in some ways to the pulse in the tongue. And the reason why the heart palpation can really go another level above the pulse in the tongue is because we are palpating, physically touching the body. Now, that's not to say that the pulse and the tongue are not really beneficial and really, really useful diagnostic tools. They definitely are. And I totally understand how the medicine has developed in different places in different ways for different reasons. So, just to put that out on the table, let's talk really about the palpation and really dialing it in. So, in the live that I was just doing, we were talking to start really simply about how our diagnostic skills can change of palpation can really change the simple things like even just our pulse taking skills. So, what you're going to do to practice this is you're going to put your hand on top of your collarbone. This allows you to relax your arm a little bit and open up your radial artery, excuse me. And then when I do this, I find a lot of TCM practitioners, not only with the pulse, but also when they're palpating, they tend to really press. So they're palpating for a point, they're really pressing into the tissue, or they're really massaging into the tissue. And for the pulse, too, I find that they're very much pushing on the pulse in order to find the pulse. So I'm going to introduce a slightly different method to that. So what I'm going to have you do instead, pulse is of course taken in the exact same positions as any other time, right? We have our Sun Guananchur positions. I like to put my thumb in the middle of my wrist in order to give myself a little focal point of balance. And then what I'm going to do is instead of pinching, I'm going to utilize the pads of my thumbs to continually search for information in the pulse as my arm, or really, when I'm taking the pulse, my whole body is able to go deeper and find the bottom of that radial pulse, find the very top of the radial pulse, and then come back to the middle and find the true middle of the pulse, what really should be the basis of our pulse diagnosis. Again, if our pulse is above the middle of the pulse, the true center of that radial artery, well, then we know it's floating. If we know it's below the true center, we know it's deep, right? So really good information that the pads of your fingers, your palpation can really aim to catch if you're just able to dial in the diagnostic bit of it, the technical bit of your diagnostics. So again, really the biggest lesson is don't push on the patient when you're trying to palpate them. You can put pressure and as far as like leaning in or maybe lifting your arm as I was just doing because it's my own pulse, but try not to pinch or push. Now, things that you're really going to want to be looking for, and this is true of the chest and the heart palpation, this is true of just palpating for points or palpating for the channel, is you're going to really want to find five key informational points. So the very first is, of course, going to be cold, heat, deficiency, and excess. Excuse me, the first four are cold, heat, deficiency, and excess. And this fifth one, which is quite difficult to explain, is called jaki or xie qi, often translated as a pernicious element or evil qi is sometimes how it's translated as well. These five elements is really what your diagnostics are going to be picking up upon palpation. And how that can really change and benefit your practice. Let's say what we're doing hara palpation, we're really palpating the abdomen. And you'll find a stomach kind of like the patient I had earlier this morning, where she had a lot of heat and excess in the upper right quadrant of the abdomen, and then she had a lot of cold and deficiency in the lower left quadrant. Now, When you do that, you have two choices now. So you found your heat, you found your cold, right? You have your yang and your yin. You found your excess and your deficiency. It's very easy to see that yang and yin circles now. So now you have a few different choices in approach, and this is, of course, going to change according to your particular style of acupuncture. How I would approach those things is then I would either go locally to where I have heat and cold and try to either disperse that heat or warm that cold, or I could go along the channels and try to affect them distally by trying to disperse the channel that it's on. For example, for this upper was the stomach, but the lower here was also the stomach channel. So it becomes a kind of a difficult decision. Do I disperse the right stomach channel and tonify the left? Possibly will work. And there's a million different other options, of course, depending on what you're doing and how you're doing it. Now, another thing that's really important about your palpation is trying to not only find the point that's active, right, that's deficient, excess, cold, really hot, or has this jucky, but then you're also trying to find the depth of that point, right? How deep within the tissues is that point residing? Are we residing at near the bone layer? Are we residing near the fascia or the skin layer? Are we residing in between the muscle layer? Because that's going to decide the depth in which you insert your needle. So your palpation not only finds the exact point, it finds how deep you need to insert your needle, and it also defines the angles at which you need to insert your needle. Now, if this is my teacher, Yasuda Sensei, he approaches every point straight on. One of my other teachers, Harata Sensei, he definitely does a lot more angled insertion. It really is a personal approach, I think, at that point. So it's not only going to find these 5 elements, right? It's going to find your depth, your palpation will. It's going to find the angle, possibly, that you're going to insert your needle at. And then also, it's going to double check your work after you've done your work. So after you've inserted your needles, after you've done your moxibustion, I would love for you to repalpate the point. So a good show of this is I had my associate today, Deirdre, doing tonifying moxa. So that's moxa that's hot, continually stacking cones on this deficient cold on my patient's lower left quadrant. And after a certain point, she was like, okay, is that enough? She thought it was enough, and I double checked, but I could still palpate for that internal cold inside. And I said, no, you need to do more. This internal cold should no longer be there. So a part of your palpation skills are, of course, 100% going to need to be backed up by experience. Experience is a huge factor in your diagnostic and, of course, all of your acupuncture and moxibustion skills, to have the experience of saying, this kind of cold I know can go away in one treatment. We're going to do more moxa, or this kind of whatever it is we need 4 or 5 treatments in order to really take care of this blood stagnation or whatever. So I'm going to stop here so I don't overtreat my client. And really being able to, through your experience, being able to continue to palpate and understand this is where it should be, or you do a technique, maybe you learn a new technique in whatever class that you join. Hopefully it's Japanese medicine, and you try it on your client, and then you repalpate your point and you're like, that point is definitely worse than it was when I started. So this is a really good learning moment, that your palpation is going to come back and teach you when you did something really right, when you also did something really wrong, right? And when you did something really wrong, then you really have to deduce, was this way I implied the technique, or was it the wrong technique at the wrong place, right? And so there's a lot of information to glean there, and a lot of learning to be made through your client there. So I highly suggest that you use your palpation to diagnose your client, not only at the beginning, but all the way through your clinical experience with them for that treatment, and continually on forward. Like, how does their muscle tension change from treatment to treatment? Is there a change? Why isn't there a change? Was it, a better change or worse change? All of this really good deducing that you should be doing in every single treatment. So we've covered a few different ways that your palpation can really help you. One is simply dialing in your pulse taking better, right? Another one is finding the correct point that needs to be treated according to cold, heat, deficiency, excess, or jucky. Trying to find the depth and the angle in which you should be treating that point, right? And then also helping you to double check your work at the end of each and every single point that you insert or burn a coat of moxa on and say, okay, did I do this correctly or did I not? So there's a lot of places that your palpation can really, really help. So I highly suggest that you start to integrate it if you haven't already. Hopefully you have, that you start to integrate it into your practice more, utilizing a few of my suggestions and maybe possibly some of your other teachers as well. Now, if you have other suggestions or other places in which you felt that palpation has really helped and benefited your practice, I would love for you to put those in the comments below. I'm really interested to hear how people are learning their palpation skills, because I know that in most schools, they're not being taught. If you are being taught palpation skills in your school, I would love to know which school you are going to. Please do put it in the comments below. And if you could tell me a bit about how you're being taught those skills, that would be fabulous for me to know. That's just information I like to tuck away in the old brain. So again, all of this information is really, really great, but it's even better though when you have someone to mentor you through the process. So if you don't already have a mentor, I highly suggest finding someone like myself to take you aside and be like, no, you're putting too much pressure on your palpation, like we talked at the beginning, too much pressure, or you're leaning and you're balancing on the client, or this is really what you should be feeling for. Feel for this cold right here. So there's a lot of this that needs to be done in person. Some of it can be taught online or through videos like this one, but I highly suggest that you go to as many workshops with someone who's very, very centered on palpation in order to learn your palpation and to develop it further in your clinic. All right, so that's all for today. Thank you so much for joining me. I am sorry for the technical glitch on the previous live video, but hopefully you got a lot from this video. Please do like, subscribe, and hit that little bell to be notified of future videos coming up. And if there's anything that you would really love for me to talk about on this channel or on these lives, or anything you'd like me to show you as far as technique is concerned, please do put it in the comments below, and I will try my best to oblige. All right. Thank you so much for learning with me today, and I'll see y'all soon.